Thank you all for joining. Good morning, good afternoon, good evening to wherever you're joining us from. Thank you and welcome back to the second session of Take a Breath's 3-part webinar series titled Breathing into the Future, Creating Healthier Indoor Spaces for Resilient Cities and Communities. We will be diving now deeper into the invisible thread that connects our cities, our buildings, and our bodies, the air that we breathe. Today's session, titled Research and Data-Driven Decision-Making to Improve Indoor Air Quality, will explore that continuum. We're thrilled to welcome a distinguished panel of experts who will discuss the macro scale of urban planning all the way to the micro realities of our indoor environmental health. They'll explore the topic from various angles, addressing the role of data and technology and the need for action to improve indoor air quality and the many opportunities. This webinar series has been designed by Goumbook. The conversations come under a Goumbook initiative called Take a Breath. It's an initiative that's endorsed by the UAE Ministry of Climate Change and Environment as it aligns with their Air Quality Agenda 2031 and is run in partnership with Al-Attar. This webinar series brings together an expert network of speakers, multi-stakeholder audience, consultancy, education, manufacturing, advertising, government, hospitality, and more, and drive collaboration across this scale to improve the indoor air quality and the air that we breathe. My name is Lama Saleh, and I am the Director of Program Development and Partnerships at Goumbook, leading on the Take a Breath initiative, and I will be guiding the discussion, joined by an all-star list of experts, Ms. Dima Srouri, Dr. Zhao, and Dr. Iyad Al-Attar. After our speakers share their presentations, we'll move into a dynamic panel discussion where we will be then concluding with an open Q&A to get feedback from the audience, from the participants, and continue these conversations. Next up, I would like to introduce our first speaker for the day, Ms. Dima Al-Srouri. Ms. Dima Srouri is a creative thought leader fusing urban strategy, design, and sustainability into transformative interventions. Her expertise comes from years of practice across public and private sectors and enriched by academic research. She leads the Biospheric City Lab, a boutique platform dedicated to imagining cities as living ecosystems while teaching urban planning and development as an adjunct lecturer at the Sorbonne University in Abu Dhabi. Ms. Srouri will be starting with the macro view, looking at urban planning, looking at the connections between both outdoor and indoor air quality, and the role of preventive policy. The floor is now yours, Dima.
Thank you so much, Lama, for the wonderful introduction. It's my pleasure to be here. I'm going to start with the macro level, like Lama said, and we're looking into breathing cities, breathing at the city level from an urban planning perspective, and how urban planning can shape air quality. So why air quality matters? Well, basically, the problem is that according to the World Health Organization, 99% of the world's population breathes air that exceeds WHO limits. This causes a lot of health impacts, respiratory disease, cognitive decline, and mental health. And we're seeing a huge economic impact on the economy, estimated at $8 trillion every year in productivity loss. So it's a huge issue. It affects everyone. But there are also opportunities that we can tackle if we look at air quality, because whatever we fix in terms of climate change and climate action also looks at air quality actions, and we'll see this in many of the examples that we're going to go through. So urban planning is not exactly linked to indoor air quality, but it's really the leverage point, because it provides the macro scale for everything else to come down. So we have the macro scale, which is the city level, and we have the meso level, which is the neighborhood level, and then we come down to the building level. So why is urban planning important? It looks at the source of the pollution. It shapes the pollution sources and the exposure pathways with land uses. It influences the emissions generations at the source, the adjacencies between the polluting uses, and the population vulnerability. And it operates across all of these scales, like I said. So how do we bridge the indoor and outdoor air quality from an urban planning perspective? Now, we know that indoor air quality is between enclosed spaces, but in reality, we have air leaks. So we have pollution infiltration from the outside to the inside. So whatever we're trying to actually fix inside is influenced by how much pollution we have outdoors to begin with. Um, Secondly, is that if they are that connected, then we cannot really separate, and we have to look at air quality as an ecosystem perspective, which is exactly what I always do. I link between different parts of the ecosystem so that we reduce from the source, and then we mitigate, and then we adapt later. So that's the approach that I always take. So if they are so interconnected, how can we actually plan our buildings to have responsive systems to respond to how bad the quality outdoor is so that we can fix it from the inside? And then we can use different tools like policy and governance tools, because this is something that's really required from a holistic perspective. So from an urban planning perspective, at a very high level, we look at creating a development that limits pollution from the source to begin with by using good urbanism principles like compact mixed-use developments, urban green infrastructure and public transport and active mobility, zoning and land use planning, and creating air corridors. Now, how does this influence pollution? It's the fact that the major source of pollution in cities comes from transport. So if we're relying on vehicles and we have to drive every day for long distances, then that's a huge source of pollution that we have. But this is high level. Let's look at more tangible and a lower level, a meso level. So in the meso level, we're looking at how the buildings interact with the street level and with the city, and what we can do about this. So we know that heavily congested areas have more pollution. So if you have traffic corridors that have extreme high traffic, then these are areas where we should not allocate schools or uses that have, young population, vulnerable population, or if we have to, then we can mitigate with buffers. We know that any area that doesn't have any air movement, like canyons that doesn't have a good airflow, these are also heavily polluted area. Why? Because the pollution tends to concentrate in these areas. So the more airflow that we have, the less pollution that we have. And this is how we start looking at the vulnerable uses, where we try to avoid locating those vulnerable uses where there are major sources of air pollution. One of the examples that we have, which is not very obviously linked to air pollution, is an example from Barcelona. So Barcelona has a unique concept called the Superblocks. And the Superblocks was actually one of the impactful examples in tackling air quality. So what is a superblock? Well, first of all, we have a block, which we all know. And Barcelona takes this super block in a very smart way. A super block is really a very large block. And in urban planning, it's not something that we actually recommend because it affects connectivity. But Barcelona does it really well by taking a number of blocks. In this case, you see 9 blocks together, looking at the perimeter of the blocks and limiting vehicular access inside the blocks. And in this scenario, it's limiting the quantity of vehicles going inside. At the same time, you limit it only to residents, emergency services, urban services, and you prioritize walkability and cycling within the parameter of the superblock. So when they did this, they started applying it and they started 20 years back, or more than 20 years back, applying the Superblocks, there was a reduction of vehicles by 82% within the block. This resulted in a reduction in nitrogen oxide by 25% and a reduction of particulate matter by 17%. And the noise pollution during the daytime was reduced by 0.4 decibel and at night by 5 decibel. So we can see how difficult that is to begin with, because we still have the vehicular movement outside the perimeter happening business as usual. By just limiting the entry and the number of cars inside the superblock, we're seeing a major impact on air quality as well as emissions as well. So we're tackling climate change and air quality at the same time. In London, they applied a similar concept, but in a different way. So here we're looking at limiting the quality of vehicles entering the city rather than the quantity of vehicles. So London started in 2003 applying a concept called ultra-low emission zone. And what that does is that there's a European standard for the type of cars related to the emissions that they generate. And they started with a smaller area, saying that only cars of higher specifications with less emissions can enter the inner city. And then they started expanding the concept across the whole city. So the business as usual scenario, when they started, the estimate was that it's going to take London 193 years to bring London's air pollution within legal limits. But by applying the ultra-low emission zones, they actually achieved that in 2025. So the reduction was 27% in nitrogen dioxide in the entire city, 54% in central London. And we can see how the more central you get, the cleaner the air it gets, which is counterintuitive actually. The reduction in particulate matter was 31%, and nitrogen oxide was 34%. And the exposure for deprived communities was reduced by 80%. And the number of sites with improved air quality was 99%. Not only they did that, they actually combined this with a participatory tool where they actually installed air quality monitors within students' backpacks. So the students were actually wandering around the city, measuring air quality and confirming that this is actually helping the city. The third example is at the micro level. So once we do this, we've reduced significantly the outdoor air quality. Now we're looking at the indoor air quality. There are lots of solutions with potential with biomaterials. And one of them is actually one material that I'm actually working with called mycelium, and it's based on fungi. Now this material, as opposed to business as usual material, is organic, it's free from VOCs and chemicals, and it's produced using natural processes. It's also circular and compostable. So it ticks many of the boxes in terms of climate change. Now, this is all great, but fixing air quality is really challenging, and there are lots of challenges and trade-offs to think of. So in urban planning, densification is always a good idea. However, it's not always great for ventilation. Like we've seen that it creates canyons. So one of the solutions to handle this is to actually always look at appropriate scale in density and appropriate air ventilation by staggering the heights. So even if you have denser areas, you have to mix it up. You have to mix the heights. It's also the fact that the green infrastructure requires so much water. And when it comes to water-scarce cities or arid regions, this is actually going to be a challenge. So there has to be a sweet spot and the appropriate balance between greenery and the water element that we have a challenge with. So creating buffers in the city to tackle air quality is great, but if we don't have enough water, then we have a challenge. And also, whatever we do, we still need to manage indoor air quality and to manage outdoor air quality. And we notice that the vulnerable communities face much higher exposure, In terms of urban planning, we always have the workforce living near industrial areas, and that puts them at more risk of pollution than other communities. So it's one of the risks that we have to trade off, because they have to live closer to work, but at the same time, they're exposed to more pollution. So with all the challenges, the way forward is to actually have a plan where health is put at the center of our designs, and treat indoor and outdoor air quality as one system, as an ecosystem, like we said, and integrate. If health is a priority, we have to integrate air quality in all urban design phases, where we look at how we can mitigate, how we can create buffers, how we look at vulnerable zones, and what we can do with them across multiple scales. And lastly, we can use digital data tools and participatory tools to benefit air quality monitoring, reporting, and improvement. So we can see here that, air quality is not a luxury. It's not for someone who can afford to have air quality monitors in their homes. We can do something at a city level and a city scale, and then improve that indoors using monitors and air quality tools, which I'm sure my colleagues will be talking about them. So urban planning can make that choice visible, breathable, and equitable by designing our cities to have better air quality with land uses and transport.
Thank you very much, Ms. Sururi. This was really insightful. We got to better understand the link between both urban design and air pollution, but also the holistic way of tackling air pollution, both how the macro level really feeds into the micro. And it was really also interesting to learn about mycelium use and air ventilation as solutions. So we're excited now to introduce our next speaker, Dr. Zhao. Dr. Zhao is the Executive Vice President and Head of Dallas Labs, where he leads research on how indoor environments impact human health and well-being. With background in building performance and smart systems, Dr. Zhao bridges science, technology, and design to develop wellness-driven innovations. He is also a WELL faculty member and an active advocate for global public health and sustainability. He also teaches at the University of Pennsylvania and received his PhD from Carnegie Mellon. Over to you, Dr. Zhao, as you shed more light on indoor air quality from the WELL building standard perspective. And through the questionnaire that we initially conducted for the participants, there was a large misunderstanding or not enough knowledge about what the WELL standard really does. So I think this is an opportunity to educate the attendees.
Good morning, good afternoon, good evening, whenever you are in the world. Thank you so much for Lama and Goumbook for the opportunity to talk about the indoor air quality and the well-being standards, and what's the connection and why it's important for all of us. As introduced by Lama, I think my background and focus is on how to make buildings healthier, smarter, and more sustainable. That's been my research, innovation, and professional work for the past 15 years. And so I'll start with this question, or this statement, that we spend more than 90% of time indoors. So from exposure and prevalence standpoint, we have to treat the outdoor air pollution as much as we can. But for individuals and companies, for a short-term solution, indoor air quality is super important for our health and well-being. And obviously, the root cause is outdoor, but for individuals, it's hard for us to do anything for outdoors, except for urban planning or policy standpoint. So that's why indoor is super, super important. And from public health standpoint, the exposure, or we call social determinants of health, or we can also call exposome, all of these terms describes how we get sick or how we get healthier from external standpoint. So the social determinants of health impact our health and longevity to a greater extent than our genetics, meaning nurture and nature what we are born with is super important, but we're exposed to every single day is even more important to our health and well-being. And among all of that, air quality is part of neighborhood and built environment, and is among all the other factors in this pie chart is super, super critical. And we have been validating what are the indoor factors that's impacting our health and well-being. And from thousands of studies and the literature review and summaries, we understand the indoor environmental quality, including air quality, and many other factors have a huge impact on every single systems of our body. Cardiovascular, urinary, skeleton, respiratory, reproductive, nerve system, all of that. And as a couple examples, for example, air quality, airborne pollutants, commonly found indoors, the PM 2.5, VOCs, CO2, ozone, mold, all of these has direct linkage to different disease outcome and risk factors. So you see this diagram, each line on this diagram represents multiple peer-reviewed studies in the past decades or so. Same thing for water quality. Air quality is super, super important. Water quality is also very important. And what you put in your mouth can have huge health impact. And these are the things in the water supply could have been the water contaminants, which can be water supply, can be bottled water, can be any source of water you drink. Lighting at the same time has same impact on health and well-being, but I'm not going into details because we're talking about air quality for now. So from the global perspective, how are these factors linked to health outcome? We didn't do the work. The global burden of disease, which is a huge, widely used database in the world by academics, government, World Bank, UN, is established to really quantify what are the health impact of different risk factors, links to disease outcomes and causes, and then links to the actual death and mortality, morbidity. So all of that can be seen in this chart. This is a ranking of global modifiable risk factors. Look at the top 3 on 2019. Number 1 is high blood pressure, which we all know is super important. Number 2 is PM 2.5, particulate matter. Air quality ranked number 2 in the world in terms of killing and harming people. Smoking is number 3. Think about all these factors that we know of smoking, of alcohol, of all of these factors ranked on here. Air quality ranked number 2, right after high blood pressure. Yet our awareness and our investments in air quality is much less than high blood pressure or even than smoking. So from building's perspective, what we have done is to link the building feature and building design, construction, and operation features that can change the outcome of PM 2.5 or particulate matter, and then which links to this disease outcome, respiratory disease, the cardiovascular disease, kidney, all of these things, then hopefully shaping the outcome of global disability-adjusted life years, death, or injuries. So again, 6.5 million people in the world are died every year from air pollution. And if we do anything on the left-hand side of this diagram, having better building envelope, no leakage, having better ventilation system, have air filtration system, have monitoring to make sure our air quality is good indoors, and also implementing policies to make sure our behavior is compliance with the air pollution. All of these measures and policies will shape the outcome of PM 2.5 and then ultimately shape the global burden of disease. Because of all of that research, we created the well building standard and launched it in 2015, 10 years ago. And it's a body of work to help any building to achieve a better outcome for making building healthier for people. And it's based and rooted on scientific research, but also considering practicality of can we achieve it? Can we make it happen? And fast forward to today, a couple months ago, the well-being standard has been used in more than 136 countries, over 5 billion square feet of real estate all kinds of real estate. And the Middle East is one of the largest markets. Middle East is about 1 billion square feet out of 5 billion square feet. And there are many people, professionals involved in the standards application. The concept of well-being standards has 10 different concepts. Air is number one, most important, most impactful, and also it's a prerequisite. You have to achieve some air standards. And then besides there, there's other things: water, light, movement, thermal, sound, material, mind, community, and nourishment. So just for time being, just gave a couple examples. What are the achieved features for well-being standards to make air quality better? Number one, air quality monitoring. If you don't measure, you don't know if you are improving or not. We're talking about improving air quality, whether it's outdoor or indoor. But without benchmark, without baseline, without knowing what the actual number is, no one can see it. Unless it's too bad, you can see the smog far from your window. But air quality is invisible. We have to make that visible to people with numbers. Number two, in India. India is one of the places among other Asian countries has worse air qualities, and this office adopted inline air filtration system in addition to conventional ventilation. Other concepts, for example, air quality is not only about PM 2.5 and CO2. It's also about off-gassing from materials, meaning materials have chemicals, volatile organic compounds. Some of them are good, some of them are bad, some of them are very bad, carcinogen. And material use in building construction and decoration has a huge impact on that, which these are some of the examples that achieved well-being standards using better and good material, which Dr. Dima was talking about, mycelium material, which is a very hot topic. Not only organic, but also is carbon neutral or carbon negative material. So this is the end of it. I want to give a very quick introduction about the well-being standards, what's the relationship with air quality, and how globally, wherever you are, especially in the Middle East region, air quality is important for everyone and anyone. And I'm sure there are many things to do from design and a technology standpoint to improve on for each individual and organization. Feel free to reach out and happy to discuss. Thank you, Lama.
Thank you, Dr. Zhao. Thank you for sharing more about the well-building standard. I'm sure everyone found that very educational. And as you mentioned, we do spend over 90% of our time indoors. So this is what we can manage. This is what we can manage through accessible monitoring and solution implementations. It has also been reported that when you improve indoor air quality indoors, then you end up also supporting health outcomes. So there's definitely a nice story to tell there. It's not all doom and gloom. I would now like to introduce our third speaker, Dr. Iyad Al-Attar. Dr. Iyad Al-Attar is a mechanical engineer, air quality expert, and academic fellow at Cranfield University. He specializes in filtration and pollutant characterization. He also advises Eurovent and contributes widely to global filtration publications. His research focuses on integrating air quality into sustainable urban development through science-based HVAC strategies and stakeholder engagement. Today, Dr. Al-Attar will discuss filtration, exposure, and systemic limits, and if technology is actually the only answer. I will leave the floor now to you, Dr. Al-Attar.
Thank you, Lama, and appreciate being here today. I'll try to share some perspectives, and hopefully I'll be able to shift your perspective and focus by the end of this 10 or 15 minutes at some aspects that we potentially have not really considered earlier on. I titled this presentation "The Courage to Change" because although we possess a lot of technologies, we still need not only social change, but we need to understand that there is a social cost for social change, and we also have to be possessing that courage to change. So let's dig deep and look holistically at what cities are for. Basically, cities compete for people, and people compete for prosperity. 80% of economic activities take place in cities. It's where 70% of energy gets used. And of course, it's where entrepreneurship and innovations happen. We all strive to live in a city because we want to gain some sort of educational and social standing. The scale, speed, and scope of urbanization now basically position us back to the 1800s, where only 5% were urbanized. Today, we're about 54. Potentially, we're going to be 70% by 2050. What does that mean? 2.5 to 3 billion people will be added to the urban environment. So we're all going to be competing, as you probably heard in the earlier two presentations, for several resources, water, of course, air. So I think today is my invitation to you. The first invitation is to reconsider the way we live. We've been heating and polluting our environment until we've broken our climate. Of course, that also questions the business model we've been running for centuries and how we interact not only with our outdoor environment, but also with our buildings and cities. Eventually, we have pollutants. And whenever you mention air filtration or air quality, somehow dust particles hover in our mind almost immediately. But that's not true because we've got lots of sources for lots of particles and pollutants. So it ranges from sandstorms to wildfires to construction and wind and agriculture. And that can give us a tremendous, massive menu of pollutants just only on the particulates. Now, on the gaseous pollutants, we're burning our planet. And when you look at these pictures, at least from an NO and CO perspective, you're probably thinking, how is that connected to the indoors, where this is the finite sink? We're going to be taking outdoor air, filtering it to render it fit for purpose for our HVAC systems. Believe it or not, all this trouble, we've only occupied as cities 2% of our planet surface. So this is something just to go back and think about and reflect on the fact that, it's only 2%. It also brings a question of how do we cohesively respond to environmental challenges? Whether it's a volcano eruption in 2010, wildfires recently, the pandemic in 2020 or 2019, and how is that going to impact our schools and workplaces and our residential sector? Or sandstorms in certain areas. I know the Arabian Peninsula and many other areas worldwide, they suffer from sandstorms. So we have airborne particles always suspended in the outdoor air. So the so-called air quality quest emerged, and now we need to look at this amazing thing that you've heard all the time. We spend around 90%. Research actually shows that we spend up to 90%. Depends, because some people don't really have access to shelters all the time. And the research also has shown that this statistics refers mainly to people living in developed or developing countries at a certain extent. But that's going to require a lot of heating, ventilation, and air conditioning equipment and air technologies and filtration. And that's sensitive and extensive to render outdoor air, whether you need to recirculate it or you need to ventilate it and also air condition it to bring it indoors. Why is this important? Because potentially we breathe up to 13,000 liters per day. So even if you inhale little concentration, at a very low concentration of pollutants, this is still very, very significant. So where do we go from here? Recently we've heard that clean air is a human right. And if it's a human right, we should deliver it to 8.223 billion people. Now, let me ask you a question. When you hear the term clean air being exchanged and used and also promised, what is the first thing that comes to mind? What is actually clean air? What are we promising these people? And what are we promising to deliver? Is it polluted air minus pollutants equals clean air? So what are the pollutants we have in mind? Is it just particulates? And what type of particulates? What are the concentrations, size distribution? Or do we also include bioaerosols? a question that kind of, came or fell under the analytical knife during the pandemic. How about gases? So again, when we are referring to clean air, are we really referring to filtered air? Challenge question we pose not only to yourselves, but also to myself and many global authorities. Maybe we should know what clean air is so that we can deliver it and defend it and eventually deliver it. When it comes to particles, there are so many other things we need to look at. So for air filtration for particulates, we need to look at the physical and chemical characterizations of pollutants. So on particulates, we need to look at particle size, shape, concentration, because this is going to influence how you appropriately make an air filter selection that is fit for purpose and fits your application sensitivity. If you don't do that, it's almost like going to the pharmacy to buy a headache medication just for any symptom that you have, not necessarily characterizing and diagnosis what is the air quality that you are up against. So what is ailing your indoor air quality and what is ailing your indoor space and eventually your building envelope? And let me ask you another question. Why would we focus so much on owning an HVAC system and filtration system when we can actually get filtered air and thermal comfort? And what's going to happen to all these loaded filters? Potentially full of dust, microorganisms, maybe gases. And as much as we bring up air filtration technologies in terms of media, filter design, what if the supply chain comes to a halt? Like almost what happened during the pandemic. There was so much stress on supply chain of filter media that even manufacturing a filter, let alone selecting a high efficiency filter, was questionable. And let me ask you a question. If you have the ability to acquire all kind of air filtration and air conditioning systems, potentially your indoor air quality does not equal to your outdoor air quality. That's not the case for those people who live outside, but that's okay because if you can afford a mask, then you should be okay. But who are the assumed users of all these advanced technologies, whether filtration, monitoring, HVAC systems? And even if we have these systems, we're still at a point where we're really attaining indoor air quality sustainably is easy to claim and hard to verify. There are just way too many moving targets. Human occupancy, infiltration from outdoors, the purpose of occupying the space. So let me give you an example here. This is a call center where when it's empty, the air quality seems to be within the allowable level. As soon as people start to arrive and work, VOCs start to increase, carbon dioxide increases, and the place is only to occupy at low occupancy or when it's empty. So doesn't that ask a question? Do I have a system that is an HVAC system with a filtration system with an air quality monitoring that can respond to two things? One, indoor air quality variation, and two, human occupancy. And if we have that with a seamless integration, we probably can talk about some sort of sustainable air quality, indoor air quality delivery. We zoom out a bit, and I know Dr. Dima touched on this a little bit, but how do we pioneer prosperity? What do we look for when we urban plan and city design? And do we have air quality in mind? Why do we design cities for people but build them for cars? Why are we urbanized but yet polluted? How can urban development be sustainable if we're clustering people and building envelopes that eventually being exposed to poor air quality? We continue to heat and pollute the environment outdoors, so this is going to require that we acquire air conditioning systems, and that will require filtration systems. But we need to look at how we transport ourselves, look at how we generate and use power. In transporting system or as a public transport system, we have always focused on living in a city, trying to be with a close proximity of the city. But I believe the connection here, or the emphasis, should be shifted to connectivity and not necessarily proximity. Dealing with traffic jams doesn't mean that we need to pave more roads, but need to look at sustainable transport system that set its stage from day one when we urbanize. I heard this all the time, and I keep on repeating it, and I'm not, going to stop repeating it. We need to be a pandemic-proof city, whatever you are. We don't want to be just ready for the next pandemic, because we don't want another pandemic. But we need to do our homework now in terms of urban planning, city design, air filtration, air quality, embed indoor air quality metrics from day one of urban planning. Previously, people have sought governance in terms of highlighting air quality and pollution and trying to link both together, and leadership and governance were important. Again, today, for us to govern air quality, we need to develop it. Monitoring and compliance is important, and that can be done through not only legislation and regulation, but also through a stimulus program and a reward program that can bring air quality to the forefront.
Thank you, Dr. Iyad. This was really insightful, very, very interesting. And the highlight of this importance of collective action, the need for behavioral, social, policy, and all of them working together in synergies with tech. Again, a holistic look on the use of tech, filtration, but also the impacts from circularity and sustainability aspect. Because at the end of the day, health does fall under the larger climate and sustainability discourse. So we'd love to open room now for a bit of an engagement between the speakers, maybe to highlight the one recommended concrete action each of you would recommend to members of the audience, whether at a personal, community, or policy level, and where we can start moving the needle today to improve air quality and health outcomes. So what would that one action that you want to leave with, how would it look like? So starting with Ms. Dima, please.
First of all, very insightful presentations. I think I really loved how every presentation builds on the one before, and then we end up kind of in the same conclusion, which is we really have to look at the source of pollution from outdoors first and then treat it indoors. But we also have to take a life cycle approach in whatever we do. Yes, air filtration systems can solve so many problems indoors, but they have a huge cost. I would also question how equitable that solution is for many non-empowered populations and vulnerable populations. And I would also look at, like Dr. Iyad said, where do these air filters go at the end of the day? So a full life cycle assessment would show us that the solution is not really improving air filtration only. We have to start at the source, and then we can use air purification systems when needed or when there is nothing else that we can do. But it's not just about feasibility or equitability of it. It's about the circularity of it and the environmental impacts of everything that we use, including the energy to run all the filtration systems. So when we take a full life cycle thinking approach, we end up looking at the cheaper ways to do this is to actually plan our cities in a way that don't pollute to begin with, beginning with the land uses and how they're organized around the movement of people. So it starts from the city and then it cascades down to the neighborhood and to the buildings. And we have to look at every possible areas that we can do to improve air quality.
Thank you, Ms. Dima. I'd like to move to Dr. J now with to hear your insights.
Yeah, thank you. Your question is to different audiences. What are the actions we can take today? I think I'll separate that into three different types of audiences. If you're individuals with a family, with kids and pets and family members, parents, for individuals, what I would recommend is definitely buy an air purifier in your home for your home. That's going to improve your little environment, indoor environments, and keep your family healthy and breathing cleaner, filtered air. And the cost of that is anywhere between $100 to $300, and the annual replacement cost of filters is about $20 to $30. And energy consumption for each filter is about 20 to 30 watt. That's the power consumption. And in most cases, you keep it really low, the wattage will be 5 to 10 watts. So it's like a light bulb in your home. I wouldn't consume much money for you. That's for individual. And if you are a company thinking about for your office, home, for your office and other types of spaces for employees, that's obviously similar recommendation depending on your budget and depending on your employees' requirements and other ventilation systems. But if you are a government agency and you have power to do urban planning, to do futuristic stuff, and to change policy, I would definitely recommend what Dr. Dima was talking about, especially, for example, monitoring the air quality. If you have a way to make policies to monitor, especially for key vulnerable population, that's a huge issue for air quality. If you can do policy changes, encouragement, incentives, that'll be hugely important. So I think, obviously, as a government, you can also consider the energy impact, the waste material impact, all of that as a whole. But for those three types of audiences, that'll be my recommendation.
Thank you, Dr. J. And finally, last but not least, Dr. Iyad, if you can give last word here.
Well, I would start from building block one. I would take things to first principles. I would first characterize physically and chemically the outdoor air pollution. What is ailing our outdoor environment or urban environment? Because eventually this is where our cities exist. For example, in the Arabian Peninsula, it's mainly silica dust. And we have traffic, we have a lot of other gases. So silica dust particles are potentially coated with other potentially gases or other contaminants. So I would just first go to the doctor, characterize and diagnose what we're up against, know what's ailing our indoor environment, then go down, as we discussed before, on the building envelope, and say, look, if I'm going to design a hospital in a specific neighborhood, I would need some kind of, outdoor air characterization from an authority to say, in this area, we have high sandstorm area, could potentially be near specific pollutants. Pollen is an issue in this area. And then we feed that information to the architects, to the heating, ventilation, air conditioning engineers, and finally to the air filtration engineers. I said, look, I need a fit for purpose air filter selection, appropriate air filter selection. Then the HVAC engineers will sit down and say, we're going to hold you responsible because we need a heating, ventilation, air conditioning system with an air filtration system that is able to respond to any variation, one in indoor air quality and two, human occupancy. Last point to make, but not conclusive, is that we need to kind of predetermine, if possible, when we design a specific building, what is this building going to be used for? I cannot just say it's a gym, and then after this, I change it to an office, back and forth. The breathing pattern changes. If you're doing, even in a hospital, when you're doing an IVF lab, the breathing pattern even changes during imperial transfer. So your system has to be responsive. Your place has to be fit to occupy. There are too many moving targets. This is why we have the technology, but we need to have seamless integration of these technologies to be able to get the kind of outcomes we're looking for.
There was a lot of questions from the audience also on the filtration standards. There was a mention of MERV 14, MERV 16. what would be good for residential health and whatnot. Do you have any insights on this particular question?
I'm glad the question came up. And, one of the things I specifically kind of didn't like the pandemic put us towards is high efficiency filters. The hype is to install high efficiency filters, and hence we're going to get much cleaner air in terms of particulates, at least, or maybe, it can capture bioaerosols. So hence we're protected. Before that, we go back to the point. We need to know what we are up against. Why install a high efficiency filter if you don't have the particles for it? Why install a high efficiency filter, whether it's HEPA, ULPA, or high MERV rating, which is a rating used in the US, North America, and other parts of the world? Why go for high efficiency if it's not really needed? Here, I'd like to use the term engineering. You need to engineer air filtration solutions. And to do that, you need to know what you're up against. So yes, I can use high efficiency filtration if I have the pollutants at a concentration, particle size distribution, then I'll be able to make appropriate filter selection. Let me just highlight, when I say appropriate air filter selection, that means I have it exactly fit for purpose. So I have a sustainable filter performance. And one last thing I would do, which I don't think has been done now extensively, is link indoor air quality to air filter performance within the HVAC system. So this way I can kind of know what's going on within my indoor environment in terms of human occupants. Maybe the emissions or the pollution comes from within the pollutants, the occupants themselves, or as Dr. Yima said, from the carpet or, being emitted from materials and so on.
Thank you, Dr. Iyad. This brings me, I guess, to a question for Mr. Dr. J about the recommendation of the WELL standard in terms of the frequency of indoor air quality monitoring. What would be the range there? How frequent?
I think there are two things here. One is the current technology is super cheap and super affordable and relatively accurate enough for continuous monitoring, which is you buy a sensor from Amazon. That's how many? It's pretty affordable, and then you will know, is that super accurate? No. But would you know the relative differences of today versus yesterday? What's bigger pollutants? When you cook, you can see spikes 3 times. Do you see that? Yes, you do see that. And that continuous monitoring will give you a sense, whether it's home or office, will give you a sense of what behavior and what events and what time series can get to the pollutants level if you monitor that, and you will have a sense of that. And that's for one, but that's encouraged by the well-being standards, but not required. The requirements is the well-being standards is a performance-based standards, meaning the outcome is important. Whether you use monitoring or not, whether you use this system, that filtration, this ventilation, we don't care. As long as the threshold, you're meeting or maintaining indoor air quality thresholds at certain level, that's good. If you don't use anything, that's zero zero energy consumption. That's the best way. If you have tight envelope, no leaking, that's the best way. So in terms of monitoring requirements, we would recommend continuous monitoring, but the standards does not require that. It's the encouragement.
Thank you, Dr. Zhao. And last but not least, Ms. Dima, a quick question for you. What do you think are the barriers for implementation, and how can these be addressed in terms of improving air quality all around, indoor air quality more specifically?
It depends on who's got the power to make those big decisions and how we're linking different aspects to air quality. So sometimes we're linking some of the pollution to emissions and not to air quality. So most of the time we look at it as, it's climate change actions. We don't need to do something about it today because we have a net zero strategy by 2050 and we still have time. But we're not really considering what we discussed today, which is the health impacts on people and the productivity loss and the mental decline and the fact that somebody has to pay for this as well. So I think we need to put health back at the center if we want a policy that really addresses air quality.
Thank you, Ms. Dima. I love that. Basically, a people-centric, health-centric approach. This is the end of the session, where we are sad to say that we are wrapping up. This has definitely been a very interesting, very insightful session. It is also part of an ongoing series. Our final session will look more deeply into the role of technology and innovative solutions to improve indoor air quality. As we mentioned, filtration and other types of solutions are not the only solution. But do stay tuned for our upcoming session taking place in the fall of 2025. These are multi-stakeholder conversations, so we would love for anybody that has a vested interest in indoor air quality to join us from all different types of sectors. Please find our contact details to stay in touch and register through the QR code on the screen to stay updated on the upcoming webinar. The road forward, as we saw, is definitely one of collaborative action for our cities and communities. And with this, we conclude, and thank you very much to the speakers and to the audience, and wish you all a great rest of the week.